My name's Rina Ruparelia. I'm in Toronto, Ontario, Canada.
My name is psoriatic. I'm coming from Rwanda.
My name is Kiara Lionel Salim. I was born back in Jakarta, Indonesia, and I'm currently living in Tallinn, Estonia.
In our normal life, you can have the same, or you can access the same telephone as the one that other developing countries have. You can have the same TV set, you can have the same shoes or other things that you need. But for psoriasis, it's totally different. Though it is known like a global disease, we cannot have an equal access to drugs or to treatment.
Just a few months ago, I moved to Tallinn, Estonia. I got lucky, I believe. It was a good opportunity that I got a job opportunity here in Tallinn, Estonia, in which that it makes me able to get the government healthcare insurance. And in here, psoriasis is considered as something important. So all of my treatment here is actually covered by the government. It wasn't a difficult process at all. And so currently, I got my biologic injection here in Tallinn, Estonia, and every month covered by the government 100%, and I just need to pay for €2.5 out of my own pocket. My meal is even more expensive than that, so can you imagine?
You know, when I think about living in Canada and having coverage and then looking at the people that follow me that don't have the same experience, it makes me feel sad for them. It also makes me feel more compelled to take steps to raise awareness so that people are able to get the same care. I don't think just because I live somewhere that I should have different treatment than someone living in a different place. I think we should all have access to the same care so that we're able to get on with our lives and not base everything we do around psoriasis. I think the people living with psoriasis who were able to get access to treatment would be able to be much better functioning people in the world, be able to give more to the world, to their families, and to themselves.
People are not aware about psoriasis here in Rwanda. Mostly in rural areas, people are not aware of psoriasis. And even people who are in the hospitals, they are not the dermatologists, they are not aware about psoriasis.
I remember being at work, I always think of the time putting on these plastic gloves, you know, with tons of like cream, just thick creams, and I couldn't bend my fingers, right? They would just split and they were really swollen and red. And I would wear these gloves just to kind of like type emails. And I wasn't aware, very odd, even though I was in so much pain, I wasn't aware of how much I was suffering. And it was this one day that I was kind of like, I took off the gloves and I was gripping the mouse and I looked down at my hands and they were just shaking. And I just started to cry, and then I had a bit of a panic attack. I couldn't breathe. I called one of my coworkers into my office and I told her, I can't do this anymore. Like, I'm in so much pain, I need help. Like, something has to change.
For the first 10 years of my life with psoriasis, I live in a victim mindset. I didn't dare to have any dreams. I didn't dare to go out and socialize outside of school. It limits me in every way, and I think my coping mechanism was just pretending that everything is okay. Everyone would tell me that Kiara is so cheerful, even though she has psoriasis. But then there were a lot of moments where I would just cry myself to sleep. I didn't want to go out. I avoid attending like birthday parties, meeting new people.
It was affecting my life because in most of the time you are embarrassed by people who ask to you what happened to you, and you do not have a response because I do not have explanation. And also there are some people who think that it is contagious because of fearing to be asked a number of questions. You start thinking on not going on a number of ceremonies or sport activities. You start isolating yourself.
If I didn't have the compassionate program, I feel that each injection would be $20,000 Canadian, something like that. Maybe or maybe that's complete, but it's thousands, tens and thousands of dollars annually. It's very expensive treatment. I wouldn't be able to afford it if I didn't have this compassionate program. And even with private healthcare plans here, if you have a pre-existing condition, it's not covered. So if I was to get my own if I was gonna get my own healthcare plan right now, the program wouldn't cover this psoriasis medication because I've had psoriasis before I was covered with the insurance program. When I think about how much I've spent on psoriasis over my life, I mean, minimum $100,000, minimum. A lot of money. Creams, everything I can find, treatments, naturopaths, all of those things came right out of my pocket.
I opted to go to Nairobi because in that time, 80% of my body was full of psoriasis. It was hurting. I was not sleeping for that time. The entire bed in the morning was full of blood. I opted to go to Nairobi to look for biologic injection. It costed me 5,000 USD. Entire year's salary that was being taken for that biologic injection.
Aside from it being expensive, we have to be proactive in asking the questions. Outside of it, also in rural areas in Indonesia, there are still a lot of doctors who do not even know about psoriasis. So getting diagnosis in the first place is also a challenge. I once met this pediatrician because I had to test for TB before starting my biologic injection. By then, my psoriasis was all over my body. It was erythrodermic psoriasis. And she insisted throughout the process that this is just an allergy. I tried to tell her, no, this is psoriasis, it's a human condition, this is how it works. But she kept insisting that, no, your doctor is just lying to you. You just need to take some allergy meds like antihistamine and you'll be good to go. She just kept on insisting, and I was like, I was trying to convince her too, but then at the end of the day, I'll just let you think what you want to think. So there's definitely a lot of gaps in the healthcare system and the quality.
Rwanda has made an impressive growth in terms of access. We have a number of health infrastructure. Each state has its health centers, but the main challenge is the number of doctors and also the access to drugs, because our national health insurance does not have a capacity to pay for all specific drugs. Those people who are affected by skin disease, like psoriasis, are paying drugs or cream on their own private money. And even when you have means to buy those drugs, there isn't a number of pharmacies that you can find those medicines. For example, we have one pharmacy in Rwanda where you can find those kind of medicines. If the pharmacy has not ordered them from outside, in that case you spend like the entire 2 or 3 months waiting without getting those drugs.
I believe that universal healthcare would have a huge impact on the world at large. When it comes to people living with psoriasis, I know many of us don't want to be sick. We don't want to be sad about our skin. We want to be out in the world, expressing ourselves, contributing to society, living the life that we dream of. So I believe that we could be functioning, happy members of society, giving back and serving in all different ways.
I keep thinking that there is something that can be done by the entire world community, by our government, so that people can have an access to medicines.
People in rural areas, they have bigger struggle to make the people around them understand about psoriasis, because it is not a widely accepted idea that there is such condition called autoimmune disease. It's like you're autoimmune attacking yourself. That is such like a very foreign idea. To let them know the fact that yes, they have psoriasis, but they are able to live hand in hand with psoriasis and still living their life. It doesn't have to stop them. It doesn't have to limit them. It's to empower them, knowing that they can do something about it and they don't have to live in pain.
So I always find it funny that I'm an influencer or that I'm, an advocate for this condition publicly because I live so much of my life hidden. And my page was started in the same way. I was hidden, I was secret, I wasn't telling anyone I was doing this. And slowly, as I guess people started to find my page, because many people weren't doing it at that point, I guess people started to ask me questions. They started to kind of encourage me to feel better about myself, maybe put on shorts. So I started to challenge myself through these little challenges, or I started to share more about what I was trying and what I was using. And I think just listening to the community and watching it grow helped me build rapport and a relationship. And then it started to get the attention of certain media outlets. And then I remember being featured in a magazine and thinking, what? I can't believe this. So it kind of organically progressed. I never got into Instagram or onto Instagram to become an influencer or a person of, support. But as things organically kind of unfolded, I went from someone who needed support to now someone who provides hope and support. I like to call myself a hope dealer.
Currently, I have two people that I'm supporting. The one is the boy in the rural area that I have known through social media. And also there is the second one that also I'm supporting. The way, as you can see, hospitals do not have drugs or cream for that or ointment that you can use. You need to buy them on your private means. And the people here cannot afford to buy cream and ointment or other related drugs on their private means. I'm supporting them within my means, and I'm supporting them financially.
I started sharing my story through a blog when I was in high school, but it was just merely as an outlet mostly to let out all of my pent-up emotions, should I say. And that becomes some sort of a habit to be more open about psoriasis. And when I started my self-healing journey back in 2019, I started to even further share through social media, especially Instagram. It was just as an intention to help myself in the beginning. I remember that I was going through another flare-up when I was off with my biologics, and I have been just feeling really down and feeling in the dark with it. And one day I was like, okay, let's get a move on. I have given myself enough time to be sad, and it's time to get back up. I took my phone, I took a tripod, and then I was taking pictures with my skin to make myself feel better. You know how making yourself smile can help to lift up your mood. And I was I posted that picture with some self-love quotes as I was journeying through my life and learning how to be more comfortable with my skin. And that went sort of viral, and that made me realize how important it is to speak up about psoriasis, because this makes a lot other people with psoriasis who are hiding in the dark too feel that they are represented. They realize, they learn that they are not alone.